This video will review laryngectomies, laryngectomy tubes, and the care of a laryngectomy tube at UCSF Health for adult inpatients. What is a laryngectomy? A laryngectomy is a surgery that removes part or all of the larynx, also known as the voice box. It is most often performed to treat laryngeal cancer after more conservative measures like radiation and chemotherapy have failed. After a laryngectomy, the individual breathes through a stoma that leads directly into the trachea. In contrast to a tracheostomy, patients who have undergone laryngectomies no longer have a connection between the trachea and the mouth and nose.
A laryngectomy tube, or Lary tube for short, is a flexible flange tube that maintains the tracheal stoma in the post-surgical period and prevents stenosis in the long term. And it looks like this. What is the care involved with a laryngectomy tube? Patients with laryngectomy tubes should be monitored for signs of respiratory distress, such as shortness of breath related to mucus plugging. In the event of respiratory distress, immediately remove the tube if you see signs. Cleaning the tube may resolve this issue. Before I clean the tube, I will put on my safety equipment, including goggles or a face shield. The laryngectomy tube is cleaned 2 to 3 times a day, and pure mucus buildup in the tube. This will be my patient with the laryngectomy tube. I'm gonna go ahead and remove it from my patient. So go ahead and remove the Velcro. And in a straight motion, I'm gonna go ahead and remove the tube. At this point, I'm gonna go ahead and remove the straps. And now I have my Lary tube. I will get a bowl and fill it with some warm to hot water. And from now, go ahead and just clean it, trying to get the mucus off. If it helps, you can definitely use one of the brushes and then get in the crevices of the tube, and just with your goal being to get as much mucus out as possible. And clean inside, outside, rinse it again. The final rinse should include using sterile water. So I'm gonna go ahead and pour some sterile water on my tube there. At this point, I'm gonna go ahead and put the straps back on the tube. And then let me bring my patient back in. Hello, patient. And then in one motion, go ahead and put it back into the stoma. Okay. And then you just attach the Velcro, and then you should be good. What is an HME? An HME, or heat moisture exchange device, can be attached to your laryngectomy tube. It looks like this as a small disc and provides heat and moisture to the airway, as well as provides a barrier against particle entry into the trachea, lungs, and stoma. It attaches to the Lary tube just like this. Boop. For demonstration purposes, here's a close-up. When placed on the Lary tube, the button should be facing out towards you. Keep in mind that patients who have undergone a laryngectomy no longer have the moisture and protection from debris that's provided by having an intact upper airway passage. The HME serves this purpose. Use of an HME device. Before using an HME on your Lary tube, ensure that you have an order for it. You should be monitoring your patient for signs and symptoms of respiratory distress. Every shift and PRN signs of respiratory distress, or if your patient complains that it's getting a little harder to breathe, you want to visually inspect your HME. So to take it off, hold on to your tube and then take it off like so. And you want to inspect it for large amounts of mucus buildup. If you do see a large amount of mucus buildup, go ahead and grab some tissue and just wipe your HME clean. HMEs can only be used for up to 24 hours. They should be changed every 24 hours and any time you see large amounts of mucus buildup that you cannot clean with some tissue. You don't want to rinse your HME because it can interfere with its function. If your HME is in place, you can provide non-humidified oxygen through a trach collar. However, if you do need to humidify your oxygen, you must remove the HME to prevent moisture saturation.
Patient education. The patient should be instructed to remove the HME before coughing to prevent mucus buildup. Mucus buildup can lead to obstruction of airflow through the HME. The patient should also be instructed to use the tissue to wipe mucus off an HME and never to rinse it with liquid or water. The patient should know to call their nurse if they have shortness of breath or increased breathing resistance, and to use a new HME every 24 hours, or if excessive mucus leads to breathing resistance. Unused HMEs should be stored at room temperature in a sealed plastic bag. Apex documentation. To document on the Lary tube and any care associated with it on Apex, first add surgical area rows as needed. Document your assessment of the tube and site every shift and PRN changes as you would for a tracheostomy tube. Also document any care and interventions when performed. Document HME use, such as being applied, removed, the presence or absence, under the status row as highlighted on this slide.
Because of the lack of connection between the upper airway passage and the stoma, emergency ventilation is only possible through the tracheal stoma. Use a pediatric neonatal size BVM or bag valve mask for this purpose. The right side of your emergency access airway caddy, also known as your trach caddy, will be checked. Thank you for watching this video. If you have any questions, please refer to the tracheostomy and laryngectomy surgical airway care procedure. If you need additional assistance, you can also contact your CNS or your NPT practitioner.